This was a poster presentation which was done in Best of ASTRO, and it is again in the section of patient safety. And patient safety was detected as global awareness. By September 17, ASTRO declared World Patient Safety Day. Patient safety is becoming a priority, and safety is no accident is the motto of ASTRO 2019, which was endorsed and developed by, so a radiation oncology specific program was created. Quality assurance program was, surveillance program was created by ASTRO with the help of Veteran Health Administration System. They together created this radiation oncology surveillance system, the quality process, because they know from a sick patient to a well patient, we need to go through all these things, not only a safe equipment and the safe treatment staff, safe environment, safe procedures, and safe material to a well patient. How do we really quantify these things? For example, to quantify every department, whether this department is performing well. This was mainly created in US to allot to the main of the insurance systems to quantify and qualitatively estimate the quality of particular departments in various sectors. Now, this has also been introduced into the radiation oncology department. So the program was called VHA NROP and created the Radiation Oncology Quality Surveillance Program. And this study was try to check whether such quality measures can be really brought into site-specific tumors, and also in different in our department specifically, other than the treatment planning errors detections. So to evaluate the feasibility of defining, can we really define it and score it a detailed set of quality metrics for common tumors, and to provide a comprehensive assessment through continuous passive electronic scoring of patient treatments. So defining quality metrics, what is quality metrics? It is just a tool to measure the quality and quantity of all the healthcare process and outcomes and patient perceptions. So the material and methods, a good number of patients were selected, 1,500 patients. But the two commonest cancer which was selected in ASTRO was IR and HR, high-risk prostate cancer, and the lung cancer, whether it is small cell or non-small cell. The data was collected from EMR and TPS system, and the nationally recognized expert panel defined the quality metrics. The quality metrics can be further defined as whether it is currently expected, or it can be an aspirational, or can be done for further surveillance. The panel still continued. They identified 34 additional measures also on case scores, aggregate scoring, and the scores related to the other centers. You can compare with other centers depending upon what is your quality and where is your levels. Data was delivered to VHA, and a score of 19 quality metrics for lung tumors and 26 quality metrics. Overall pass rate was determined as 82.4%. But if you watch this, the pass rates for lung cancer overall was only 78%, whereas prostate cancer was 87%. The aspirational QM prostate cancer for quality of life was very low, whether it is only 50%, when less than 50%, even at the time of consultation or at follow-up in more than 17 centers. Survivorship and bone health assessment even were still low, and the treatment options that were discussed with the patients and the frequency of follow-up evaluations were varying widely between the different centers. When the results continued, quality measures, passing scores for lung cancer assessments were very similar across different centers, but they all were less than 60% when smoking cessation, cardiac devices evaluation, motion management, prophylactic cranial artery, and follow frequencies were considered. Of course, the collection of molecular markers and clinical trial participation were also equally low among different centers. Not only about the clinical things, it was also defining the dose volume histogram. Quality metrics were also defined. If you can see in GU, especially the prostate cancer, the mean pass rates were more than 90%, very good. But in lung cancer, if you see, only 3 out of 18 centers were about 90%, and others were only just more than 80%. Whereas when the quality of dose volume was less, only 50% for brachial plexus and ipsilateral lung was less than 30% was achieved. So in order to conclude, this may be a very, very small topic, but it is evolving slowly, and it is very, very important to have quality metrics in radiation oncology for a pathway of personal pathway. Every department, when they follow, they will know their percentages. They will know from the peer reviews to know that where they stand, how much they can improve, how the performance can be improved. Thank you, sir. Thanks for giving me the opportunity.
Okay.